The least invasive thing we can do to the neck would be liposuction. We often call this chin liposuction, or typically you'll hear us say submental liposuction. This is limited in what it can do. It's good for younger patients that have a lot of fat under the chin, or a double chin, we would say. I do think my best use for this is patients who, with a large nose, and we're doing a rhinoplasty where we're trying to get the nose smaller. Oftentimes we can do some submental liposuction, and it really, really does a nice job of modifying the result for their rhinoplasty, actually. So typically we do a 1 centimeter or less incision under the chin, and usually a 1 centimeter incision under each ear, right at kind of where the earlobe meets the face. You do get a little bit of bruising for 5 to 7 days, but it covers well with makeup, and there's not a lot of incisions or anything. Those incisions heal flawlessly, so there's not a lot of downtime. And about 92% of people say that it's worth it, so people are pretty happy with the results. Now, one thing you can add to that, which I do frequently in younger patients, is a MyElevate. So that's a trademarked term. Actually, it's a minimally invasive neck lift, in which you can see here, you make little tiny incisions. We're talking 5 millimeter or so incisions, and you pass a suture back and forth, back and forth. And what you do, they call it, another term for this is trampoline platysmaplasty. And the reason is because, just like a trampoline, it holds everything up. It is minimally invasive. It really has very little downtime. I will say that I've found that the results tend to fade after 2 years or so. So again, this is for younger patients. Oftentimes patients are getting other work done, and we'll just kind of add this on to kind of sling things up for a couple of years to bridge them to a facelift or whatever it is they might need in the future. I will say this is actually a pretty good result as far as the MyElevate, and so you can expect this, or honestly maybe a little bit less of a result, and so I don't push patients to do this very often. I have seen infections with this, and it can make future neck lifts more challenging, so you just want to make any surgeon aware if you do get this done later on down the road that they may encounter that suture or some inflammation when they do your facelift or neck lift.